Well, hello there. Good afternoon, everybody. My name is Tim Bentley, and we are here today for our talk on tinnitus, what's ringing in my ears, managing tinnitus. You might be wondering where Maya Luria is, and Maya is the Director of Senior Services here at TMC. My name is Tim Bentley. I'm the manager of marketing and advertising and wellness. Maya is planning an event for another group of people and has asked me to step in. So I'm going to try to leave you in some capable hands. Maya is such a pro at this. We're going to get through this together, and I want to welcome Haley Lanoue, who is an audiologist here at TMC, to talk about tinnitus with us today. How are you doing, Haley?
Doing well.
We're glad that you could join us. Thank you for. We were on before, I must confess, and I was having her coach me on how to say tinnitus because I want to say tinnitus, and she says that that's okay too. So, but I'm sure she'll give us some good information about this and about the services that we offer here at TMC. So thank you for joining us. A couple of house cleaning items. We are recording live today on April 27th, 2022. If you have a question, you can leave it in the comment section of the platform that you're watching, whether it's YouTube or Facebook. Go ahead and type it in. It'll show up on our dashboard, and we'll let Haley answer those towards the end. If you're watching this after the fact and you're watching this perhaps recorded on YouTube or on Facebook, you can still ask a question for Haley. Just go ahead and put it in the comments, and one of us will forward it to Haley and she'll respond, or we'll respond for her on that same platform. So any information that you have questions about, we can get you an answer, whether it's today or at another time. So Haley, I'm going to ask you to introduce yourself and say hello and tell us a little bit about your background, and then we'll get started.
Okay.
Where are you from?
Thank you. I am from Phoenix, Arizona, and I have made my way back to Tucson. I went to the U of A for my undergrad degree. I am an audiologist here at Tucson Medical Center. I work with dizzy patients as well as patients with tinnitus. So I'm excited to be here. Thanks for having me.
Sure. I'm going to drop off, but I'm in the background. So if you need anything from me, Haley, just give me a shout and I'll advance your slides, but I'll look forward to talking to you at the end. Okay, here we go.
All right. Okay, so let me introduce TMC Audiology. So there's 4 of us located at the Atrium building, which is on the northwest corner of Grant and Rosemont. We see patients of all ages, so newborns all the way up to as old as you can possibly be, and we do audiology diagnostic testing for hearing loss. We manage hearing loss and tinnitus with hearing aids and cochlear implants. So we kind of do it all. I also do some balance testing as well. There will be another presentation in May on that, but today we're talking about tinnitus. So we're going to talk about what tinnitus is, some causes of tinnitus, and then really what we're going to focus today is tinnitus management and some resources for you and kind of next steps. All right, next slide. So what is tinnitus? It is pronounced tinnitus or tinnitus. Those are both correct pronunciations. So I say tinnitus. It's what I heard first, probably. They're both correct. And tinnitus is the perception of sound when there's no external stimulus present. So if there was absolutely no sound on in the environment, it's something that you're hearing, but it's kind of within your head, for lack of better terms. Most people describe it as a ringing sensation or like a high-pitched tone, but it can be any sound that you hear that's not in the room that you're in. So it can be buzzing, ringing, chirping, humming. Some people say it's pulsatile or pulsing. Some people say it's musical, low pitch, high pitch, anything that you hear that's not caused by an external source. And it's very unique to each individual person. So not every person has a different reaction to tinnitus, perception of their tinnitus. Everyone is different because it's just something that you yourself hear. So that's what tinnitus essentially is. And all of tinnitus can occur in one or both ears or in the head. So some people only hear it in one ear, the other, a lot of people say it's just somewhere in their head. It can be constantly there. It can come and go. Sometimes it can get worse. Sometimes it can get better. All of those are true of all tinnitus, and it really ranges from non-bothersome to completely debilitating. So some people, this impacts every aspect of their life. Some people have it all the time and don't pay any attention to it. So it's really an individual sensation. When we talk about tinnitus, there's a couple different types. So chronic tinnitus, so what we'll be talking about today, is any of that sound, that ringing that you hear that lasts for technically over 5 minutes at any point. So again, that can come and go. Maybe you only hear it once a week, every now and then, every day. It's when it lasts for that longer duration of time. Transient ear noise is something that almost everyone experiences at some point in their life, if not frequently. It's kind of that few seconds where all of a sudden you hear like everything kind of feels muffled for a second. Usually it's in one ear and it's like this high-pitched ringing sound. Everything's muffled, but then it goes away after a few seconds. Most people only experience it for about 5 to 30 seconds. That's pretty typical. That's a normal thing within the population. Chronic tinnitus is when it's lasting for that longer duration. Subjective tinnitus is what accounts for almost all tinnitus. So that's a sound that's only perceivable to you, the patient. No one else can hear that sound. No one else can tell you what it sounds like because only you hear it. That's over 99% of the cases. But there is objective tinnitus where it can actually be measured. It's a sound that's created within your own body that you can measure or someone else can hear. That is incredibly rare. So we'll mainly be talking about that subjective tinnitus today. So prevalence, you are not alone. There is a large population that has tinnitus. There are a lot of different studies trying to figure out how many people have tinnitus. It's a difficult thing to ask questions about and really pinpoint. So there's a lot of range in those studies. Ranges anywhere from about 10% up to 30% of the global population have had tinnitus at some point in their life. Of that global population with tinnitus, about 20 to 25% of the people report it as a moderate to a very big problem. And then about 1 to 3 of people with tinnitus find it to be debilitating in their life, impacting all aspects. There is a higher prevalence with age. So the older you are, the more likely you are to have tinnitus, as well as noise exposure. So people who are around loud sounds, either for work or recreational, have a higher chance of having tinnitus. The amount of hearing loss you have, and then military and veterans also have a higher prevalence of tinnitus. It's actually the #1 service-connected disability for veterans in the VA. And once again, it's individual. Some people are not bothered by it. They hear it all the time, but they can ignore it. And other people, it impacts their daily life and overall well-being. The most common aspects that it impacts are sleep. So it can make you harder to fall asleep and impact sleep overall, trouble concentrating, anxiety and distress, depression and social isolation, irritability, frustration, and all of those things, when you start having those impacts, can really put a strain on the important relationships in your life. So again, it's highly individual. Not everyone will have all of these things. Some people do. Overall, what I want you to take away from this presentation today is that there is help for your tinnitus. So before we really get into more about tinnitus, I'm going to go over how you hear, because we can't really talk about anything with the ear without knowing what it is. So this is the picture of your ear. What you see highlighted here is your outer ear. So that's what you see, your ear canal all the way to your eardrum. So sound gets funneled and then it comes through that ear canal and it vibrates that eardrum. and then it goes into the middle ear. So the middle ear is highlighted here. It's an air-filled space with 3 little bones inside, and those are helping amplify the sound. It's connected to your sinuses through something called your eustachian tube, and so its main purpose is to amplify sound and then equalize that pressure between the outer atmosphere and your ear. So that's if you feel like your ear pop, it's in that middle ear. And then all of that sound gets amplified and pushed into the inner ear. And so the inner ear is the sensory organ for hearing. There's the vestibular system, which is part of your balance system. We won't be talking about that today. We're going to be talking about the cochlea, though. The cochlea is what takes those sound signals, the vibration of sound that's amplified in the middle ear, and it takes that and it converts it to an electrical energy to be sent through the nerve and up to your brain for understanding. So it's a really complex system through here that essentially takes sound waves and turns it into electrical energy for your brain to hear. And so once the sound goes all the way through that ear system, it goes through the outer ear, the middle ear, the inner ear, it goes through the nerve, then it has a lot more work to do. So this is just one kind of simplified representation of what that sound is doing in your brain. So your ear is responsible for hearing the sound, but your brain is responsible for understanding that sound. So once you hear it, it goes through the brainstem, and then it goes through all of these different structures out to the auditory cortex. So your brain is responsible for figuring out where that sound came from, what that sound means to you, how you're going to interpret that sound and respond to that sound. So your ear is responsible for hearing it, but your brain is responsible for really understanding it. And so why we talk about all of the ear and that it's so connected in your brain is because honestly, we just don't really know the exact cause of tinnitus. There's a lot of different theories, there's a lot of ongoing research. What we do know is that tinnitus is a symptom, not a disease itself. So it's indicating that something else is going on. It's a response to something, not necessarily the disease itself. The majority of tinnitus is what we call neurophysiologic, which just means that something happens somewhere along the auditory nervous system. So the outer ear, middle ear, inner ear, or somewhere along that pathway in the brain gets disrupted. There's a change, or there's like a hearing loss or some kind of change. How your brain analyzes that change is what results in the tinnitus. That is the majority of what we see in the clinic with tinnitus. So again, tinnitus is a symptom itself. It does not cause hearing loss, but there are a lot of people who say or think that they have hearing loss because of their tinnitus, and that's because most people with tinnitus do have some degree of hearing loss. It might just be a very mild amount. The tinnitus does not cause the hearing loss, but the hearing loss can cause the tinnitus. And tinnitus can also cause things like difficulty concentrating, which might make it more difficult to hear. So we don't know the exact cause per se of tinnitus, but we do know that there are over 200 associated events. So there's a lot of different links that are correlated with tinnitus, not necessarily causative. So anything that I say that has a higher prevalence or a chance of getting tinnitus doesn't necessarily directly cause tinnitus. It just means that there's a higher chance of people with tinnitus with something else. Anything that can cause hearing loss, there's going to be a higher chance of having tinnitus. So that can be earwax plugging up your ear, an ear infection, hearing loss due to noise exposure or aging, genetics. Anything that can cause a hearing loss can therefore be associated with tinnitus. There is a direct correlation between the degree of hearing loss in the prevalence of tinnitus. So what that means is if you have more hearing loss, a more profound hearing loss, there's a higher chance of you having tinnitus. But that's not always the case, and it doesn't necessarily correlate with the severity of tinnitus. So just because you have a lot of hearing loss and you do have tinnitus doesn't necessarily mean it's going to be severe for you. Someone with no hearing loss can have really severe tinnitus. Someone with severe hearing loss cannot have tinnitus at all. So it really varies, and there's no direct cause. One of the biggest correlations with tinnitus is noise exposure, and that is because we do know that noise exposure can cause hearing loss. And it is a modifiable risk factor. So this is something that you can take to help prevent the onset of tinnitus. The louder the noise is, the less time it's recommended that you be around that noise. Over the level of about 85 decibels is when regulatory bodies like OSHA recommends hearing protection for workers around that kind of noise. And then the louder the noise is, the higher likelihood of getting hearing loss and then therefore having tinnitus. Almost all of us probably experience this at least once in our life. If you go to a concert and you're standing near the speaker and it's really loud, and then you leave that concert and then everything feels a little bit muffled and then you have that ringing in your ear, that's because of that noise exposure. So it's really important to use hearing protection when you're around loud noise. You can use the foam earplugs that you get at the store, over-the-ear headphones. There are custom earplugs as well that are made specifically for your ear canal. TMC does do custom earplugs. If you're interested, you can schedule for that. But something that's important to note is that noise exposure causes permanent damage to your ears, and it's additive over the lifetime. So the more noise you hear, even if you were really young and you were going hunting or shooting without hearing protection, that can impact how much hearing loss you get from noise later on in your life. So it's not just, this did not give you hearing loss at this time, and therefore you won't have hearing loss from that noise. It adds up over our lifetime. So it's really important to protect from noise exposure. And then there are a lot of associated risk factors. Again, not necessarily causative factors. If you have these things, it doesn't mean you're going to have tinnitus. But if you have these things, there's a higher likelihood of having tinnitus. Some of the big ones are concussion or traumatic brain injury, head or neck injury, anxiety, depression, increased stress, sleep problems, cardiovascular disease, and then other things like caffeine, alcohol, nicotine, certain medications, and then there's even ototoxic agents. So things like certain chemotherapy drugs are all linked to an increased chance of tinnitus. And so again, not causative, but there are a lot of potential risk factors involved. So we're not going to get into the real in-depth everything that can cause tinnitus, but what you can do is you can schedule with an audiologist or a physician. So there are certain times where you should seek emergency care because of a hearing loss or tinnitus. If you notice a sudden unexplained hearing loss, maybe you woke up and you just couldn't hear anything, or you're only hearing a loud ringing in your ear, we do want you to seek emergency care. So in urgent care and emergency department, you want to get that checked out right away. If you have a trauma, maybe you had a head injury and something impacted your ear, we want you to get emergency care for that. If there's paralysis of any muscles in your face, emergency care. And then if you are having extreme anxiety, depression, or hopelessness, please seek emergency care for that. Other things like if you have an ear infection, if you notice some drainage from your ear, really severe, intense tinnitus, we want you to see a physician. So maybe your primary care doctor or an ear, nose, and throat specialist. But other than that, you can probably just schedule with an audiologist. So there's a gradual onset of tinnitus, it's just been bothering you more. You've seen a physician and they recommended you go see an audiologist, come see us. And then we can also direct you further if needed. So schedule a hearing test. Like I said, anything that can cause hearing loss can increase your chance of tinnitus. So if you have tinnitus, there's a good chance something is going on. So we want to do a thorough diagnostic evaluation. We're going to look for hearing loss, signs of ear infections, and other kind of red flags that we would want a physician or an ear, nose, and throat specialist to look at. And an audiologist will be able to tell by your hearing test if you need to be referred on or if your tinnitus can be worked on with just an audiologist. And most often, there are signs of hearing loss, such as aging or noise exposure, or even just earwax impacting your ear, and an audiologist can help with that. So a lot of people, when we talk about tinnitus management, want a cure. And at this time, there is no cure for tinnitus. So things like you see over-the-counter supplements that say it's going to fix your tinnitus, certain medications that are claimed to fix your tinnitus. There's no evidence that those really work or are significantly better than a placebo effect, and so we don't recommend them. Also, any supplements you take, you should really talk to your primary care doctor before adding those in, because sometimes the side effect or risks of them can outweigh any potential benefit. The American Academy of Otolaryngology and Head Neck Surgery, so those are the specialty physicians that look at your ears. They recommend against any medical cure for tinnitus at this time. With that, though, there is significant evidence that shows that there's a lot of management strategies that can significantly improve your tinnitus. So just because there's not a pill we can take to make the tinnitus go away, there's a lot of research showing a lot of different ways we can help you live with it better so that it doesn't impact your daily life. And there's a lot. So there's a lot of different strategies. There's a lot of different trains of thought on how best to treat tinnitus. There's a big list of them here. Some of the big ones that you may have heard of are things like tinnitus retraining therapy, tinnitus activities treatment, progressive tinnitus management, sound therapy. They're all useful. Even cognitive behavioral therapy is a significant one that we can use, and therapists can also use to help manage that tinnitus better in your life. And so none of those approaches are shown to be significantly better than another, but they all individually show improvement compared to nothing or a placebo effect. So we know that doing something is better than nothing. We know there's a lot of tools in our toolbox that we can use to help you with your tinnitus. A lot of the approaches have common themes in them. So that includes education, counseling, getting a hearing test is an important one. A lot of them focus on habituation to the tinnitus and reducing the negative reactions to tinnitus, using sound therapy, and overall a patient-centered interdisciplinary approach. So referring out to physicians and therapists and seeing your audiologist. The overall goals of tinnitus management are generally to feel less stressed by the tinnitus and essentially get you to a place where if you hear the tinnitus, it's not bothersome. You can ignore it. You're not thinking about it, is generally the goal of tinnitus management. And it's important to find what works best for you. Tinnitus is very individual, and that goes with the treatment for it as well. So if something isn't working, we have other tools to use and to try out to find what works best for you specifically. And so I'm going to kind of go over some general things that I recommend at first, not necessarily specific treatments, but some general strategies overall. So habituation. Our brains are designed to pay attention to new stimulus. They're doing this every day. Our brains are constantly seeking anything new to figure out what that is. Habituation is when that stimulus becomes well known and it loses relevance. Our brain does this every day. When you went to put on your shirt this morning, your brain knew that it was there, it was something new on your body, but then it forgot about it. You probably didn't remember or really notice your shirt very much until I'm starting to talk about it again. And that's because your brain habituated to it. And that happens daily with so many things. Habituation does not occur when that stimulus is associated with a negative emotion. So if every time you put on a shirt, you got bad news, that means whenever you put on your shirt again, you're probably going to be anticipating that bad news. You're going to be stressed about it. You're going to be concerned and worried about it. Generally, tinnitus becomes bothersome when we're not able to habituate to it. So people who they have tinnitus and they just kind of forget that it's there, they've habituated to it. When the tinnitus is there and then we start really noticing it and it becomes really bothersome, we start having a negative emotional response to that. It becomes stressful. It's impacting our sleep. It's impacting our concentration. We start to have an emotional response to it, and that's when it becomes a problem. So a lot of tinnitus management works to help us start habituating to that tinnitus and reduce those negative emotional responses so that we can live with it better. We can habituate it. We can forget that it's there for a bit. Next slide, please. Okay, so tinnitus is usually most noticeable in quiet. Most people come to me and they say, yeah, it's worse at night, or it's worse when I wake up in the morning. And that's because it's really quiet in your environment. When you're trying to go to sleep at night, it's dark, it's quiet. If there's no noise on in your environment, all that's there for you to pay attention to is that tinnitus. Your brain is going to hear that. It's going to latch on to that sound and it's going to say, all right, well, this is here. I like information. I'm going to pay attention to it now. And so once you start paying attention to it, it tends to feel like it's getting louder. And then when it gets louder, you pay attention to it more, and it starts creating this negative cycle. A sound-enriched environment can break up that cycle. So when the only thing is there is your tinnitus, that's the only thing you're going to be paying attention to. But if you add something in like sound, it's going to let your brain focus on something else and kind of forget that the tinnitus is there as much so that it's less bothersome. Because if we're not noticing as much, it's not going to be as bothersome to us. And so a good example of this is thinking of a candle. So next slide. So this candle, it's in a dark room. All you can see is the candle. It's very prominent. That's all you can see. That's all you're paying attention to. If this were your tinnitus in a quiet environment, all you're going to have is that tinnitus. It's going to be very prominent. It's going to be there. It's the only thing that your brain is looking at or paying attention to. But if you turn on the light in that room and that candle's actually sitting in a kitchen table with a lot of other things going on, it's not as noticeable. Yeah, it's there, you can see it, but you're also paying attention to the flowers on the windowsill, the different chairs, everything else that's going on. The same thing with noise. So if there's other things happening in your environment, the tinnitus might still be there, but instead of being here, your brain is going to have the other things to pay attention to, and it's just going to blend in a lot better. It's not going to be as bothersome because you're not only paying attention to that. So each tinnitus program, like I said, I'm not going to get into too many specifics on the different programs. They all kind of use essentially one of two things, either masking the tinnitus so that it's covering it up, you don't hear it, or habituating to it so that you still hear it, but it's not as bothersome, to help reduce that negative emotional response to it. Working with an audiologist that specializes in tinnitus management can go through all of the different types of strategies with you. I'm going to focus on something that I think is pretty universal and helpful for most of my patients, which is the progressive tinnitus management approach that recommends 3 types of sound. So those are background sounds, soothing sounds, and interesting sounds. So background sounds just help you reduce the contrast. So that's more of the habituation. It's there, but it's not bothersome. A background sound is something that's easy to ignore, something that's neutral. You don't really have an emotional response to it. Something like a fan noise, wind noise, elevator music, cafe noise, birds chirping. Something that's there, you can hear it, but you're not really having a strong response to. Everyone experiences that differently. Some people really hate the sound of white noise. So that would not be a background sound for you that you would want to use. You would want to use something else. Again, just something that's neutral to you. It's there, but you can ignore it. Soothing sound is something that when you put it on, it automatically helps kind of relieve some tension, reduce your stress, something that you like to listen to. Again, this varies for everyone. Sometimes that's people like ocean waves or a rain machine or hearing like a thunderstorm in the background. Some people like calming music or meditative music. For me, I do have tinnitus at night. I really like one specific album that I've listened to for a while. It's something I don't have to listen to every word because I'm so used to it, but when I hear it, it's relaxing and it's calming to me. So that's going to be different for every single person. Again, something that's not terribly interesting, you can kind of forget it's there, but that lets you relax a little bit. And then there's interesting sound. So this is something that is going to help divert attention away from the tinnitus. Something that you can actively engage with. So a TV show, movie, radio, podcast, audiobook, calling a friend, talking on the phone, nature sounds, something that you enjoy, that you want to be engaged with, that can really help divert your attention. So can we go back actually? So using these 3 sounds, generally, if you're hearing your tinnitus and you're kind of bothered by it and you're going through your day, you can use some background sounds to just have something else in that environment. Maybe that's a fan noise going on when you're trying to fall asleep at night, leaving the window open when you're working during the day, something like that. And then when you start to notice that you're feeling really stressed out by it, it's starting to become overwhelming, that's when you switch to the soothing sound to kind of reduce that negative response so that you can have a sense of calm, a sense of relief when you hear that. And maybe that is when you are going to sleep at night. Something soothing is usually what I recommend at night. And then an interesting sound, when that tinnitus is really getting overwhelming and it's the only thing you can think of, I want you to do something interesting. I want you to try and take your mind off of it completely so that you can give your brain that break from it. It's going to help break up that cycle. So turning on the TV or radio, an audiobook, calling up a good friend or a loved one. Those kind of things that you're really interested in is what you're going to use when that's just a really overwhelming response. And again, you all want these to be things that you like. You don't want to use a sound that you have a negative response to. If you hate the way white noise sounds, don't use white noise. It's going to differ from everyone and it might change over your lifetime. I used to use the same sleep sound every night to go to bed, and eventually I got really annoyed of it, so I switched it. That's common, and it's something that we just kind of have to adapt with as we go on. So where do you get these sounds? So anywhere. You can use outside. You can open the door in your office. You can have a fan on. Maybe move like a radio or something right next to you so that you can hear it. A lot of music streaming services, so Pandora, Spotify, Apple Music, your old record collection. YouTube has a ton of specific ones for tinnitus, a ton of like rain noises, maybe a fireplace crackling, anything that you can kind of look up. TV and radio stations, smartphones are really beneficial for this. So the new iOS 15, actually, if you have an iPhone, they added background noises that you can play from your phone, and you can stream those just on your phone or through any headphones, which is pretty cool. That's in the accessibility settings. And then free apps. So there's tinnitus specific apps that kind of walk you through different soundscapes. Any of the major hearing aid brands, some of them are like Resound, Widex, Starkey, Oticon, Phonak. They all have some kind of tinnitus app. Tinnitus Balance, I don't recommend paying for anything because there are so many free options out there. There are ones specific for sleep, and then there's ones for like meditation or relaxation. A guided meditation can be really beneficial for falling asleep at night. Again, I don't recommend paying for something, but there's so many out there. Sift through them, see what you like, see what you don't like. I recommend kind of making a list of things that you do like using, and then maybe things that you don't like using. So when things get overwhelming, you have something you can look at and refer to and easily pick out, so that you don't have to start looking for all of them in the midst of it being really bothersome. So how to listen. Anything that makes sound can be used to listen. Some things to consider are if you need the environment to be quiet for other people that are there. So say you're in a shared office and the other person can't stand the sound that you want to listen to, you might want to put on some headphones for that. There are things like open ear headphones. That first picture on the bottom left of your screen is something called a bone conduction headphone. They can be pricey, but what it does is it allows you to hear sounds going on in your environment while playing sounds directly to your inner ear so that you can hear those sounds, but no one else can, but you're still involved in the environment. For sleep, there's things like a sleep headband where it will play the sound through headband speakers, or even those little white speakers on the bottom right you can put underneath or in your pillow. And so it plays it just directly to you, so it's not bothering other people. There are also tinnitus specific things you can just put basically like a Bluetooth speaker on your nightstand or TV, radio. If those aren't working for you, or you need something more that you can take throughout your day without just wearing earphones all the time, there are on-ear tinnitus sound generators, which are essentially hearing aids programmed just to play noises for tinnitus. And then hearing aids as well. So hearing aids, if we go to the next slide, are a great help with tinnitus. So like I mentioned, most people with tinnitus have some kind of hearing loss. And for the majority of people with tinnitus and hearing loss, treating that hearing loss helps reduce the tinnitus. Because if you have a hearing loss, you're not getting that stimulation. You're not hearing the background sounds in your environment. And when we amplify those sounds for you so that you can hear them, we're stimulating those areas of the brain so that they have other input besides the tinnitus. And then you're also hearing things like your footsteps, your clothing rustling, the birds chirping. You're hearing those background noises again. And that is usually enough to help reduce the sensation of the tinnitus. But the really cool thing about hearing aids is even if just treating the hearing loss with the hearing aids itself is not enough for you, you can stream those tinnitus sounds to the hearing aids through like a smartphone. Almost all hearing aids these days can connect to a smartphone for you to stream any kind of sounds from the phone. And then we can also put in a tinnitus sound generator into the hearing aid as well. So it's amplifying the sounds that you need for your hearing loss, and then playing like a sound over it to help reduce how bothersome that tinnitus is. So we have a lot of options with hearing aids. So again, it's important if you have tinnitus to get a hearing test and talk to your audiologist so that you can talk about the tinnitus. If the hearing aid works for you, about 60 to 80% of the people benefit from the hearing aid alone, but those 20 to 40%, we have other options using those hearing aids as well. Other strategies. There are a ton of them, and really it's finding what works best for you. When that tinnitus is really overwhelming and bothersome, and it's the only thing, go do something that you like. Make that a priority to do things that you find enjoyable in your daily life to give you some overall stress relief. So maybe that's going on a hike or a walk or a bike ride or meeting up with some friends, going to see your loved ones. Anything that you like to do is going to help distract you from that tinnitus and how bothersome it is. Mindfulness and meditation have proven to be really beneficial. There are specific programs for mindfulness-based strategies for tinnitus reduction. I'll have some resources at the end. But overall, meditation can help reduce your stress overall, help you fall asleep, help you deal with those stressors in everyday life, which can also help reduce your tinnitus. Mental health care and therapy and cognitive behavioral therapy. Anything that you're learning there can be applied to your tinnitus as well. And there's specific cognitive behavioral therapy for tinnitus reduction as well. So if you do have a higher stress lately or anxiety or depression or something else, even if you don't have like a mental health disorder, therapy can help manage those everyday stressors and therefore reduce how bothersome that tinnitus. Again, if you're more stressed out, you're more likely to have the tinnitus. So if we reduce that stress, we can likely reduce some of that tinnitus as well. Improving quality and quantity of sleep. There's that cycle again. Tinnitus can impact how well you sleep, and how well you sleep can impact how bothersome that tinnitus is. So we want to break up that cycle any way we can. Anything that's going to improve your quality and quantity of sleep is likely to improve your tinnitus as well. So maybe that's using soothing sounds at night. Maybe that's doing a meditation to calm your brain, reading a book, something to put you in that sleep, ready to sleep mode, having a good bedtime routine, or even seeing a physician and getting a sleep study done to see if there's something else that's impacting your sleep. Reducing caffeine, alcohol, nicotine. So if your tinnitus is really bothersome and you're really stressed out, and then you're not sleeping as well, and then you wake up because you're not sleeping as well, and you drink 5 extra cups of coffee in the day, those are all probably piling up on top of each other. So focusing in on maybe if you reduce some caffeine, or maybe you reduce how much alcohol you're drinking or smoking, those can impact the tinnitus and reduce the tinnitus as well. Support groups are kind of a double-edged sword because overall we're trying to forget about our tinnitus. So if you're going to a support group or reading everything online all the time, you're just really focusing on the tinnitus, and that's not what we want. We want it to be in the background of our head. We don't want it to be what we're thinking about all the time. But talking to people that also experience tinnitus can be really beneficial. You are going through something that's pretty stressful and can really impact your life. And if you talk to someone else about that, you can relate, you can get that support there. So again, it's kind of a double-edged sword. It can really help, but it can also just make you fixate on it and make that tinnitus worse. So finding that balance is important. Again, everyone is different and everyone is going to respond to tinnitus differently. So finding different things that are specific for you is what's most important. And to reach out if you need help. So here at TMC, like I said, I work with tinnitus patients. I really enjoy working with tinnitus patients, so you can come schedule with me. We are at the Atrium building on the 3rd floor on Grant Road. If you call that phone number there, they'll give you some more information. A physician referral is needed for an initial evaluation at TMC Audiology. Once we receive that referral, we'll give you a call to schedule as well. I'll do a comprehensive evaluation. I can even do a tinnitus evaluation, so quantifying how loud it is, what pitch you hear it at, and then using questionnaires to help evaluate how much it's impacting your life, and then that can also be used to track your progress over time. We'll work together to create an individualized treatment plan. We can make that list together of what works and what doesn't. We can talk more in depth about those different therapy approaches and what all of that means. And we can really talk in depth. We can have as much follow-up as we really need to, as you can schedule. So you can schedule with me, other audiologists. Just getting a hearing test in general is very important. Talking to your physician. Some audiologists really specialize in all of this. Some people mainly just treat the hearing loss, but any audiologist can help you. And then here are some resources. So there's a lot of information online, and there's a lot of things like in the store saying this will cure your tinnitus. So I want to direct you to some things that I follow, I know are good resources for you. The American Tinnitus Association, ATA.org, is a great resource. They're funding a lot of research. They have up-to-date information. They even have a podcast. It's more a clinical-based podcast for people like me working with tinnitus patients, but it's not bad to listen to. And they have a ton of resources online for you. Something that I really like, the VA has put out Progressive Tinnitus Management. If you search NCRAR online with tinnitus management, you can actually find a whole workbook that they put out. It is geared toward veterans, but it's a lot of great information. They have a whole YouTube series doing more in-depth talks about progressive tinnitus management. There's the websites up there for tinnitus retraining therapy and tinnitus activities treatment. Again, there's a ton of resources. So these are just some really good ones that you can look up, and you know that you are getting a lot of good information at from those resources. If you go, there is Aloha in Southern Arizona, Adult Loss of Hearing Association. They do have a tinnitus support group. I don't know too much about it, but they're a good community resource. American Academy of Audiology, American Speech Language Hearing Association, those are like our boards for audiology, so those are good resources as well. Again, you can contact us, you can come see me. This is going to be recorded, so you can view this as many times as you'd like. And I'm happy to talk with you more about that.
Wow, that is such great information. Thank you, Haley. That's, I had well, my grandma told me that I was going to go deaf because I listened to my music too loud. And I would assume that's probably a lot of your patients, is that you find that they are people that have, just over time have hearing loss. And
yep.
So there's a few questions I want to ask and make sure that I have a couple follow-up questions for you. Laura, who is watching us on Facebook, and I'll tell you, we're recording live today on April 7th. So if we're answering your question live, that's great. If you're watching this on a recording on another platform, on Facebook or YouTube or someplace else, go ahead and ask a question in the comments, and we'll get the question to Haley and have her answer it back to you. So don't feel like you're going to miss out on getting your questions asked. But Laura over on Facebook says, my tinnitus is likely due to metabolic changes. Is there any chance it will go away on its own? I've had it over a year. She's had it for a year, metabolic changes. Is that a common? What do you have for Laura?
Yeah, that can cause tinnitus. Tinnitus is a bit unpredictable. We don't know. What we do know is there are things that can manage it. I can't say for certain what your tinnitus will be like tomorrow, in a year from now. It might get better. Using these strategies might help you just know that it's there. It is metabolic changes. you know it's there, and you can just kind of start to put that in the back of your head so it's not as bothersome. We just don't know, unfortunately, what's going to happen, if it's going to be there forever or if it's going to come and go throughout our lifetime. But using these strategies can help.
Okay. Also, a common question that we get is, I saw that people need a referral to come see you. So they need to go see their primary care physician. What sort of questions should, when they're talking to their primary care physician, should they ask? They probably likely know that they're having some hearing loss, but what kind of questions can they ask their primary care physician to help guide them to you or to somebody on your team?
Yeah, so you can just say, I have tinnitus, I would like a hearing test, and they'll send that referral over. Even if you don't think you have hearing loss and you just have tinnitus, a hearing test can give us some good information. It's always good to just get a baseline, so that if things change over time, you can look back and see what it was before. Things that are kind of like red flags that we look at medically are if it starts really suddenly or it's really intense. You definitely want to talk to your doctor about that. If it's only in one ear, that's a little bit more concerning than if it was in both ears and it was the same in both ears. So telling them if you've had any medication changes that might have correlated, or any other life events that might have correlated with the onset of tinnitus. But yeah, most of the time when you do mention tinnitus, most primary care doctors will just send you over to audiology anyway. And most physicians allow you to just email and say, hey, I want to get my hearing tested. And they're like, okay, cool, referral.
So Cheryl over here on Facebook says, and maybe you can address it why it's more serious. She says, I sometimes get this in my right ear. And I just heard you say that it can be a little bit more serious or more worrisome if it's just in one ear. Why is that?
So if it's just in one ear, what an audiologist is going to be looking for is if there's a difference between your ears. So there can be some medical reasons like an ear infection, something going on the nerve. There are some rare instances that do need a medical evaluation by an ear, nose, and throat specialist. There are very rare tumors that can cause tinnitus in one ear. So you want to get that checked out. Most of the time, we don't know why it's just in one ear and it's not much of a concern. But if you do notice it's in one ear, it's good to get that evaluated.
Okay, great. So I think a lot of people that are watching this today, I know we're hosted by Team C for Seniors, and those of us that are wise in age maybe have gone to some concerts or listened to music too loudly. What is some advice that we can give to the next generation behind us? I mean, was my grandma right when she said don't listen to that music so loud? What kind of advice can we give to those behind us?
Yes, your grandmother was right.
I knew it.
So we know, and there's a lot of research backing this up, that loud noise causes hearing loss, and then anything that can cause hearing loss can increase your chances of tinnitus. Damage to your ear caused by noise is irreversible. So you want to really protect throughout your whole life. If you're around loud noise, that's going to a concert, wearing earplugs at concerts, hunting and shooting. Anytime a gun goes off, if you're not wearing hearing protection, there's a chance of getting instant hearing loss. You don't want that. Lawnmowers, power tools, anything that is louder than, say, like a hair dryer, you probably want to be wearing hearing protection around. Making sure that when you're listening on your headphones, you're not listening with the volume way up. Sometimes what happens when we're listening to just like our regular earbuds, they're not very good at always blocking out the other background noise. So say you're constantly out and about and you're listening to your earphones, but you want to listen to it louder so you can hear it over the street noise, you're going to really crank that up. You want to avoid that. So maybe look into getting something like noise canceling headphones so that you can listen to it at a lower level to still hear it clearly. There are earplugs made specifically for concerts. I know a lot of younger people like to go to concerts and they don't want to wear earplugs because they're worried about the sound quality. There are earplugs that are made that don't impact the sound quality, and they bring everything down together. So you're still getting that sound quality, but just at a softer level. And with that, I notice if I go to a concert without hearing protection, by the end of the concert, there's usually a temporary shift in your hearing. So you're really not hearing it well anyway by the end of the concert. So it's better to wear hearing protection so that you can get that clarity of sound throughout the whole thing. If you have been around loud noise in the past, or if you have a hearing loss, making sure to always wear your hearing protection when you're around loud noise in the future.
No, that's good advice. I know we all like to listen to music. So tell us again how we can get a hold of you, Haley.
Yeah, so if you get a referral for TMC Audiology, once we get that, we'll call you to schedule, or you can call 520-324-1055. That's the number for the audiology department, so our front desk can answer any questions there. And then you can also just call general TMC line and say, I want to schedule with audiology, and they can help you out.
Right. Well, do you have any last words for us? I really appreciate your spending some time today talking about our hearing and ways we can take care of that. Do you have any last closing words for us?
I would say if you are concerned about your tinnitus, get a hearing test. We're here at TMC that can help you, but any audiologist that you can get to, get your hearing tested, talk to your audiologist, protect your hearing from noise exposure, and there is help. So if something is not working for you, we have a lot of tools that we can reach from. We have a lot of different strategies, more than just what I've talked about today. So reach out for help.
Great. That's good advice. Thank you very much, Haley. We'll look forward to seeing you again. And everybody else, thank you very much for tuning in today, and we'll talk to you soon.
Thank you.